You made it to the Go Commando Show with Fred Galvin. On our new mission, we contend with the naked truths of health, leadership, and overcoming adversity. Now it's time to Go Commando.
Hey Commandos, we have an awesome guest for you tonight who is both a researcher and professor at the University of Kansas Medical Center on sleep. So she is going to talk to us about all of her research, which she's found, and how sleep affects our mind, our body, our memory, concentration, mood, a whole host of things. So before we get started, when it's time for me to hit the rack, it's always a mission where I have to go commando. And if you really want to go commando, you can get your clutches on one of these nice Go Commando shirts. You can go the long sleeve, short sleeve, polo. You can even get them for the ladies in your life. Please support us by going to gocommandoshow.com and check out the shop and get yourself a shirt today. It supports us, bringing you great guests like Katie. Now, before Katie comes out, she mentioned that to get a good night's sleep, it first starts with turning out the lights. And the other product which you really need to check out is the Amazon Echo. So you go on to the Go Commando Show website, which supports us, and you click on, when you're on Amazon, click on Echo, and we've got the large version for $79, or the smaller version here. It's a quarter the size, also decent sound quality. That's only $29. And these will tell you the answer to anything, just like Google. And with the smart switches, they can turn on and off your lights, your heat, your alarm. They can lock your doors. They can do everything. They can play your favorite songs and podcasts. So go on the gocommandoshow.com, go click the Amazon, and please buy the Amazon Echo or any other of your favorite devices to include the smart switches. Make your life better today. Thank you. And it's time to go commando. Hey Commandos, we have an incredible show for you today. And this is a rare opportunity to talk about sleep. And we have a lady who has spent her professional life not just involved in studying with physical therapy and trying to figure out how to maximize the caring and the healing of patients, but also studying sleep and its impact on a wide range of patients, people like myself, as well as people who have recovered from strokes, as well as people with MS. So welcome, Katie.
Thank you. Thank you for having me.
Thank you. And can you talk a little bit about what led you to want to become a physical therapist, and specifically one who studies sleep?
It started honestly back in high school. I always kind of liked science. I always loved studying about the human body. And in high school, we had a career fair where various graduates came back to talk to us about their careers. And one woman came back and she was a physical therapist. And that was really the first time I had learned about physical therapy or really even heard about it. And she was a pediatric physical therapist, and she just loved her job. I mean, the way she talked about it and, you know, the joy she got from treating people and just how she was able to help people, that was what I was like, that's what I want to do. And so I kind of chose my classes in high school, obviously, to kind of focus on science and the human body. And then I went to Rockhurst University in Kansas City, Missouri, and did my biology undergrad there,
right.
Which really just kind of fed into, yes, this is the correct field for me. Because, again, I love studying science. I love studying the human body. And I did my physical therapy master's at Rockhurst as well. And at that time, after I graduated with my master's, I went and I practiced full-time for a couple years. And I kind of always knew I would go back to school. I love school. I love to learn. I love the school environment. And so kind of getting a PhD was always in the back of my mind. But I wanted to be able to practice for a couple years because I think I really felt like that would help inform the study that I would do when I did my PhD. And so while I was working full-time, I was surprised at how many of my patients would report having difficulty sleeping.
Right.
And I didn't feel very well equipped on how to help them sleep better. I could talk about positioning and things like that, but beyond that, I didn't really know what to tell them about. So that's really what started my interest in learning about sleep and really what can I as a physical therapist do to help people sleep better. And as I was starting to think, well, maybe it's time to go back to work on my PhD, I was put in contact with Laura Boyd, who was a new faculty at KUMC, and she was studying different factors that influence motor skill learning in people who'd had a stroke. And so things like, amount of practice and type of practice and scheduling of practice. And so that was really her area of research. But there was a lot of evidence coming out that sleep is important for consolidating what you learn during the day. Basically, those connections get strengthened while you're sleeping. But it had only been done in young, college-age, healthy adults. So it's kind of a natural pairing then to look at would sleep help people who'd had a stroke relearn or learn new motor skills.
Right.
And so then that's really what my PhD work was understanding if sleep would help people learn new skills after they'd had a stroke. And so that's what got me into kind of the sleep field and obviously what I did my PhD in. And as I started to learn about sleep and really have to obviously have a really good basis of what sleep is and what all it includes, I was very intrigued at how sleep not only affects learning, but how it also pretty much impacts all the different systems of the body, from immune function to tissue healing to cardiovascular health to cognitive function. And so it expands so much more than just from that motor learning perspective. And so that really kind of has opened up my kind of perspective about the importance of sleep for all these different body systems and for your overall health. And I have a big interest in, again, as a PT, really educating physical therapists, but also healthcare providers as a whole for what are things that we can do to help our patients sleep better. And so that's kind of what my research interests are right now.
As you mentioned, when you were starting this path toward in your PhD, Dr. Boyd had conducted a lot of research, but there was not a lot on patients that were not optimal health, such as people who have suffered a stroke or MS or long-term chronic. It was, as you said, young, healthy people who is a little bit different category. So when you began your PhD and subsequent studies, what did you start to find out as far as what are some of the contributing factors that lead to memory loss and inability to concentrate and process information quickly? What are the causes of that you have found?
So if we stick with people who've had a stroke, I mean, so a lot of that happens, because of the areas of the brain that have been damaged from the stroke or the connections that get lost because of the damage of the stroke. Sometimes people after they've had a stroke, they have depression. They're not as active as they once were. They have a lot of significant changes in their life role and their life function, which can also contribute to some of those cognitive changes that we see. And what my research then really focused on, it was, we were studying a very simple motor task. So they would track a pattern on a computer, and we were interested then if those who slept would actually do better on the task compared to those who stayed awake for the same period of time. And lo and behold, we did find that those people who slept would do better on the task without any more practice. Yes. So they weren't practicing, they were just sleeping. And so I was not having people sleep in a sleep laboratory, though. So I had no idea what was actually going on in their brains while they were sleeping in between that practice session and the retention session. And so that was then my next line of work. So after I graduated with my PhD, I started a faculty role at University of Kansas Medical Center in the physical therapy department. And I received funding from the American Heart Association to basically follow up on my study, but do it in a sleep laboratory.
Yes.
So that I could look at the different sleep stages that the individuals were going into to see if any of those would seem to be important contributing factors to learning that motor skill. So we looked at different sleep stages, we looked at different cognitive domains. There's kind of a whole range of cognitive domains from attention and memory and verbal learning and all those different things.
Were there significant findings that you found from your research for causation of impaired learning directly to lack of sleep or
So we weren't doing any sort of like a sleep deprivation study. Right. So we weren't necessarily trying to get people to not learn the skill. I mean, that's kind of a different line of research that people do, not necessarily people with stroke, but where they actually, keep people awake for the night and see if that interferes with their ability to learn. We were more interested in kind of looking at what were the characteristics that would seem to enhance the ability to learn after a period of sleep. Is it something about the individual, be it their cognitive processes or, their depression levels or their anxiety levels, or is it actually like the different sleep stages that are driving that motor learning that happens while you're sleeping?
In non-medical terms, what were some of those significant findings with sleep and how it affects memory and concentration and learning?
Mm-hmm. So we ended up having a fairly small sample, so we didn't have as robust of findings as we would have hoped to have, but we did find that there were a couple sleep stages that do seem to be important for learning after you've had a stroke. But it also largely seems to be some individual characteristics, like stroke severity is one of the big contributors, and also the ability to pay attention. Obviously, if you can't attend to the motor task, it's harder to learn. So there's probably some combination between those sleep stages, but also those individual characteristics that combined is what's facilitating people to learn, or at least to benefit from sleep, to learn new skills or relearn old skills. So that would be definitely kind of, next projects to really kind of dive into what is the optimal combination of those individual factors and the sleep factors to really know what is optimal to drive motor learning in people who've had a stroke.
Yes. And I'm by no means any kind of sleep expert, or I've not spent a lot of time researching, but I've read several different reports stating on what a lot of researchers believe is optimal sleep, and some of them have dissenting opinions on whether it's 8 hours or more or 7. So for the typical individual who is trying to maximize their daily functions and memory is a bit of a concern, or they're starting to see some of it slip, what have you found as far as getting quality and quantity of sleep in the appropriate amounts is an average?
So the American Academy of Sleep Medicine recently put out a position paper that says the recommended amount of sleep for a healthy adult or to maintain optimal health is actually 7 hours, at least 7 hours or more on average at night. And so, 7 hours or more is pretty, there's a lot of range that could happen in there, but at least 7 hours. And I think what I also generally tell people is that it's not always the quantity that matters, but really also the quality.
Yes.
Because for some of the individuals that I work with, they may sleep for 8 or 9 hours, but still, aren't feeling very good, or their cognitive function is slowed down. So really it becomes a question of, well, what's your quality of your sleep like? Because you may be sleeping for that amount of time, but if you're having these micro arousals throughout the night, then your sleep's not very consolidated. So you might be getting a good amount, but it's not quality where it's going to be sufficient to support your health and overall well-being.
Right. And you've conducted some studies on how aerobic exercise can, make a difference with the quality of sleep. Can you discuss that a little bit?
Sure. So I was very interested in expanding my research from just working with individuals who have stroke to also individuals who have multiple sclerosis. So there's a pretty active research group here at KUMC that looks at different factors for people with MS. And so it's kind of a natural group for me to start working with, and knowing that a lot of those individuals have sleep difficulties, a lot of changes after they've had a diagnosis with MS. And so it was a group that I really wanted to start working with. And we got some funding from the National MS Society to do an exercise study to see if that would impact sleep in people who have MS. And so we randomized a group of individuals who had MS into either doing an aerobic exercise program. So it was moderate intensity aerobic exercise 3 times a week for 3 months was one group. And then we had another group who was randomized into a stretching and walking group. So they would still do the stretching and the walking 3 times a week for 3 months, but they did it on their own, and it was intended to be low intensity.
Right.
And it was intended to be our control group. But what we ended up finding is that both groups actually had improvements in their sleep quality, which from a research perspective wasn't what we had anticipated finding, but really from a clinical perspective, I thought it was great. I mean,
Yes.
I was very pleased to see that it doesn't matter if you're doing a moderate intensity program or if you're doing a lower intensity stretching and walking. Both groups seem to have improvements in their sleep quality. Now, we think there's likely different reasons for that. Like there's likely different mechanisms. Obviously, if you want to have an improvement in your cardiovascular health, you need to be exercising at a high enough intensity to have changes in the way that your heart and your lungs function. And so in the people that were doing the aerobic exercise, they did see an improvement in their cardiovascular health, or cardiorespiratory health, and that seemed to correlate with the improvement in their sleep quality. Whereas with the walking and the stretching group, they did not see that same change in their cardiorespiratory health, which you wouldn't expect them to, right? Because they're exercising at a lower intensity. And so what I suspect for that group, it probably had more to do with, they were getting outside to walk.
Yes.
So they were being exposed to the natural sunlight. They were getting out of the house, whereas before perhaps they were more likely to stay inside. They were walking with a family member or a friend, so there was also kind of that social connectedness that I think was happening. So probably different mechanisms, but both groups had an improvement.
Yes.
Which again, from a clinical perspective, I was really happy to see.
Yes. Now, for many listeners and viewers out there, they're busy working a lot of hours, and maybe they can't not get a full 7 or more hours a night because they've got kids and their activities. Maybe they're studying as well as going with a full-time job. So what would you say as far as cardiovascular exercise and improvement of sleep of people that don't have MS, but is there any studies that you've been aware of how cardiovascular and aerobic exercise can improve the quality of sleep for someone of my age that's a working professional? Would it help me sleep better?
Mm-hmm. And so I know I'm not quite as familiar with that line of work, but I know there are some studies that have looked at the benefits of exercise, and they use exercise as far, it could vary from meditative movement type exercises like yoga and qigong and those sorts of things, or more moderate intensity aerobic exercise. And those studies do seem to suggest that those types of exercises, again, be it aerobic exercise or more meditative type movements, do seem to have improvements on improving sleep quality for kind of a wide range of people. I know they've looked at healthy college age people, they've looked at people with various medical conditions. And so, there's obviously lots of benefits to exercise, but improving sleep quality seems to also, for a lot of people, seems to also be a benefit.
Those of us that have taken periods of time off where we were unable to do all the cardiovascular exercise, obviously, sounds like you just said not so good if you're not getting some of that in our normal daily schedule or enough of it. But then also for those, and I'll be guilty of acknowledging this, who've burned the candle at both ends for a number of years, and what do studies show as far as the impacts of somebody that's getting like sleep deprivation, like 4 or 5 hours of sleep ongoing for 5 days a week for months or years? What are the known impacts that can lead to as far as your health, your mental health, and your physical health?
Right. And that unfortunately is a big problem in our society, is like you said, kind of people being at that kind of low levels of sleep deprivation where you're getting 5-6 hours of sleep every night for a prolonged period of times. And there definitely are health consequences of being in that constant state of sleep deprivation. There's it impacts your cardiovascular health. You're more likely to have cardiovascular disease, coronary heart disease. It affects your cognitive function.
How specifically with cognitive function as far as memory, learning, ability to process information? If I'm somebody that's only getting 4 to 5 hours of sleep each night, which I've had, and I found it difficult to retain things. So I've been in the habit of writing every single thing down because my memory just can't handle it anymore. Is there studies that have shown that it's definitive that it does lead to memory loss or long-term cognitive damage or early Alzheimer's? What kind of risks would I or other people be putting themselves into by not getting proper rest?
Right. Like I mentioned at the kind of the beginning of our talk, is that we know that sleep is important for a variety of health benefits. For good immune function, so you're more likely to get sick if you're not sleeping, getting adequate sleep quality, your ability to heal from injury, cognitive function, we can talk a little bit more about that, cardiovascular health, motor learning. But as far as like the cognitive piece, I mean, there's quite a bit of research that shows that people who aren't getting optimal sleep, so in that state of sleep deprivation, it affects their ability to maintain attention. So obviously if you're having to attend to, somebody talking or to the road that you're driving on, your work, it's much more difficult to attend to the things that you need to pay attention to. The other cognitive domain that is impacted by poor sleep quality, chronic sleep deprivation, is also working memory. So your ability to put information, like you just said, put that information into kind of short-term use. So, making lists of things you have to do or not be able to remember what you need to get at the grocery store or be able to remember phone numbers, kind of those sorts of things.
Yes.
Also executive functions. So like ability to do like problem solving, kind of higher level thinking abilities is definitely interfered with if you're not getting good sleep. And the kind of the area of research is that's highly looked at is the ability for physicians, for physicians and residents and fellows who maybe aren't getting optimal sleep for long periods of time, and if they're making errors and medical errors and how that impacts patient outcomes is obviously an area of interest and emphasis. To touch on the risk for Alzheimer's disease, there is evidence that while you sleep, so beta amyloid is one of the hallmark signs of Alzheimer's disease. So there are different plaques that form in your brain that interfere with the ability for your brain to work properly. And so while you're active during the day, while your neurons in your brain are active, beta amyloid is getting expressed. And that's normal. But there's been studies in animals that have shown that while you sleep, during that deep restorative sleep, that helps to flush out the beta amyloid that's accumulated during the day. So if you're not sleeping well, you're not getting into that deep, restful stage of sleep, that beta amyloid is more likely to sit in your brain and potentially accumulate, putting you at a higher risk for developing Alzheimer's disease down the road. So that's actually a study that we're putting a grant into the NIH to address people who have insomnia. Because we know that if you have insomnia, you're at a much higher risk for developing Alzheimer's disease. And so I would like to, what my proposed study would look at is, if we could identify people who have insomnia, so these would be older adults, and treat them with, it's called cognitive behavioral therapy for insomnia. So it's a non-pharmacological treatment of insomnia. If we can help them sleep better, address their insomnia symptoms, will that impact the amount of beta amyloid that gets accumulated over a year? And also will it impact their cognitive function? And of course, we're hypothesizing that if we can get people with insomnia to sleep better, that it'll improve their cognitive function, and it'll also reduce the amount of beta amyloid that gets accumulated across a year span. So hopefully we'll get funding for that at some point and be able to do that study.
Another topic, and it's kind of two-pronged, is what has the research shown regarding the impact of stress on the brain and then possible positive impact of laughter and de-stressing, and what are those effects on not just mood but memory, concentration, brain function?
I'm not terribly familiar with the stress and laughter as far as, or stress reduction, how that impacts mood and things like that. I mean, obviously, I know that stress, anxiety, depression, those are all very related to sleep, and so I look at it in the context of how is that related to sleep, and then how does that impact health and things like that. which obviously, those kind of go very hand in hand. If you're anxious and you're depressed, you're more likely to have sleep issues as well. And so you can't, oftentimes when we do our sleep interventions, we also have to, kind of keep in mind, what's the person's anxiety level, what's their depression levels, because knowing that those are very related.
Yes. Now, I know with technology, we just spoke recently about, some physicians have, a problem, with memory and, burning the candle on both ends are a very high stress, high demand job. But, with our technology these days, with OneNote and all these things to schedule an appointment, and a lot of people are finding ways to function, although our own mind's not able to recall it like we maybe once were or should be, but technology is there, to save the day.
Yeah.
And everything. But some of the folks I know, don't just have, and I think I heard a gentleman who was a politician said that the millennials, and whether I didn't see the study on this, he said millennials have a mobile device next to them for 23 and a half hours out of the day within 18 inches. And but that obviously not just stress related to always going to something that can remind you, but somebody texting you.
Sure.
People that don't basically turn off, turn off their phone, or some people are sleeping with it and aren't getting that good quantity and quality. Are there things that show, with technology, we're not getting that kind of sleep because of technology, that it can impact us and our cognitive functions?
Yeah. I think you bring up a very good point, is that's probably why we see a lot of sleep issues, is because now we are always connected, with our phones, with our devices, so we're not, we're not turning off those stresses and, so I think it's the content that we're viewing on our devices, right? If you're keeping up with work and you're not unplugging, or you keep up with school or whatnot. So I think there's the content part. But then we also know that the blue light that gets emitted from devices, from electronic devices, also interferes with the amount of melatonin that gets secreted. And so it suppresses the amount of melatonin that gets secreted, which then can interfere with your ability to fall asleep and maintain sleep. And so it's kind of a two-part thing where it's, you're always connected and you're not kind of taking that time to de-stress before you get into bed to try to sleep. But then you also got that light that's interfering with your ability to sleep. And I really hope that there is, and I see it happening, is that there's kind of a cultural shift that's happening in the nation, that people are really starting to understand just how important sleep is.
Right.
I think the more that you see in, popular news, having people like you covering it as topics in your podcasts, there's definitely a lot more interest, and I can recognize that, and I think people recognize that, and so burning the candle on both ends, as you say, really, people have a much better understanding that really is detrimental for not only your current health, but also your long-term health.
Right.
And I think just as we need to prioritize, eating well and exercising and, de-stressing and all those things, we also just need to recognize that quality sleep needs to be a priority.
Yes.
And so that could mean, that you reduce the amount of activities that you or your kids are doing in the evenings, or you're getting off your device and you're kind of setting times that you let yourself be on your device. I mean, I think it's just a matter of, saying, I'm going to make good quality sleep a priority for me, and then following through with that.
It's very important. I've read this one book called Lights Out, and it mentioned how with technology, not just mobile devices, but all the way back to, the electric light bulb, and how that changes us throughout the year, with the longer days in the summer and less periods of light in the wintertime. That is signaling things in our brain with a longer day and more light, that we're supposed to be storing some fat. But with the advent of electricity, we can stay up with the light bulb. We can stay up all the time, and people are, I grew up and there wasn't 24 hours television. Now we have 24 hours of news. So, especially with, news wants to hook you and sell you some product, and
Sure.
so it's become very sensationalized, and it leads to a lot of partisan things, but also like same way on social media and YouTube. I mean, as soon as you get done watching one thing, another one's loading, or a friend maybe connecting you, and so that light, whether it's from television or a computer or mobile device, that is having an effect. And that's one of the things, it's of no benefit to me. I'm not trying to, tell somebody to come and see Katie to get a sleep study, but it is very important for everyone to be very well aware, not just of getting to bed on sleep, but to have some guidelines of how important sleep is, and not just how important it is, but how you do get good sleep, when to start switching off of, maybe how in the olden days we used to just talk more because news didn't go on all night, but now people can watch things on their computer in the middle of the night, and they are doing that, and it's having a problem with, I noticed my career in the Marines, it always seemed like the more you learned, we call them continuing actions, the more we needed to know, the more we learned, the more we knew, like, this needs to be added, and we want to be perfect because human lives are on the line. And I remember often leaving work, and this is when we were not overseas, just training to go overseas, leaving work at 3 or 4 in the morning, or some days just working straight through. And there are listeners out there that kind of have that chronic obsession of, and they can't get good sleep. What are some of those known side effects of, the severe negative impacts of not getting sleep, like the sleep deprivation? When that happens to the category, it may not be everyone, but there are people that are not getting sleep on a consistent basis. And what's the risk of that, Katie?
Yeah. I mean, there's a lot of health consequences of not getting quality sleep for a long period of time. I mean, again, getting to the ability for your immune system to work properly. You're more likely to get sick and get infections and get the cold. The ability for your tissue to heal. So if you have any sort of injury that's happened, you're less likely to recover from that. I think the cognitive processes, being slowed with reduced attention, reduced ability to problem solve, the impact it has just on your cardiovascular health. And we know that people who are chronically sleep deprived and don't get adequate amount of sleep are at a higher risk of dying from cardiovascular consequences. Of course, your increased risk of Alzheimer's disease, and you're also at a higher risk of becoming obese because of the loss of regulation in appetite and some of the hormones that impact your appetite. You're also at a higher risk of diabetes because of the way that it affects insulin and glucose. So you really are putting yourself at a lot of different health consequences if you are not getting optimal sleep for a long period of time, or even just for it doesn't necessarily even have to be a very long period of time to put you at higher risk. And so again, I think people just need, I love talking to people like you so that I can kind of get that word out there that, sleep really is an important thing that we all need to be doing if we want to have optimal health.
Yes.
And if we want to, have good health quality, and if we want to have good emotional health and emotional well-being, we really just need to prioritize that. And I think also thinking about ways to implement good sleep hygiene. So you kind of talked about, what are maybe some things that people could do to improve their sleep quality. And two big ones is the first one is really having a very regular sleep schedule. I mean, as best you can, so going to bed at the same time and waking up at the same time, because that really helps to set that circadian rhythm.
Yes.
So doing that on work days, on the weekends, on holidays, things like that, as best you can. And then also the concept of stimulus control. So like when you're in bed, you should be sleeping, and everything else should be done outside of the bedroom. So like no eating, no watching TV. Things like that should be done outside the bed so that your brain knows that when you're in bed, it should be sleeping.
Yes.
So those are two big ones.
No big dogs in the bed, right?
Well, so no big dogs. And that's always one of those. It depends.
Maybe that helps you sleep.
Right. Generally, in the bed itself, not ideal.
Yes.
But on the floor next to you is probably better, because in the bed, if they move, they're more likely to wake you up. or at least have those micro arousals,
Yes.
things like that. But yeah, I mean, so environmental things like making sure that your room's dark, obviously as quiet as possible. So using white noise machines or using earplugs are also things to think about. Having a comfortable temperature.
Not drinking a lot before you go to bed.
Alcohol is another thing.
Or just water.
I think there's a misconception because people think, oh, if I have, a couple of beers at night, that it'll help me fall asleep. And I usually tell people that's true. It might help you fall asleep, but it's going to interfere with your sleep consolidation. So
Yes.
you're more likely to be woken up throughout the night, and you spend less time in that deep restorative sleep. Being cognizant of the alcohol intake for sure. I think also too thinking about implementing a relaxing bedtime routine, and so that's very variable. Some people, I like to read a book before I go to bed, so it might be reading a book. It could be taking a bath or a warm shower, but definitely getting off of your device.
Yes.
An hour or two before you need to go to bed, and thinking about what might be a relaxing routine for you. Some people like to do yoga. Some people like to do other relaxation activities. But the key is really to find something that works for you and then be
Right.
consistent with it. Because again, you want your brain to think, okay, I'm doing my relaxing bedtime routine. What next?
Yes.
It's going to be sleep. It's going to be bed and sleep. So those are some things that people can implement and try to do to help improve their sleep quality.
One of the things I remember a phase in my life, I'd be putting out fires at work all day. And then once everybody would leave, I know they'd take some of their work home, and I would send out the simple tasks that I knew that they needed to do so that they could continue to work on those from home, not being a slave master. But those were the things that had high priority that needed to get done, and I needed to task somebody to take care of those. One of my problems was after I finished the day and completed those tasks so that those people can do what they needed to do, and hey, you guys need to take care of this before we show up tomorrow, then I'd start working on some of the longer term plans, which had, which were a little bit more complex in in sophisticated as far as organizing those things. And that would stir in my brain, and I'd be up. I found it very difficult to go to sleep, and then as I was trying to sleep, I'd have a notepad next to the bed. So if I woke up, because I knew, okay, I need to involve this and this, I'd write those things down, and I just realized, looking back, the people that I've worked with, it was important to train them so that some of that load can be shared. So, if you're in a capacity as an operations officer and you're driving in an organization and you're the chief, you need to get some of those Indians promoted to where they can handle that, because in myself, it really interfered with my sleep hygiene. I'd wake up in the mornings just feeling mentally exhausted, like having a terrible migraine headache, because when you're only getting 4 hours of sleep and it's constantly interrupted. And I think a lot of folks out there these days, you see how many advertisings there are for beds and the perfect type of bed, and it seems like everybody's selling them. I know where I live, there's just one place and there's 3 bed stores on one block. It's just amazing that people really, they want to get good sleep, but it's more than just the bed.
Oh, definitely.
It's something that we have to intentionally, not figure out a way where we ourselves can, carry a heavier load, but to train other people. And you mentioned something that's very important that I'm not an expert on, and I know you are. You mentioned melatonin, and that's something that we have in our bodies. And what's the impact on not having enough melatonin or taking a melatonin supplement and getting quality sleep? What's the results on that?
Your body naturally produces melatonin, and it produces more so in the evening time as you're getting ready to go to sleep. And so I'm not a physician, so I don't recommend melatonin or not. I mean, that's a conversation to have with your physician for sure. And I do know that there is some emerging research as far as the benefits of melatonin. I do know that in my reading about it, because I get asked about melatonin quite a bit with the patients that I work with, A lot of times people take melatonin at the wrong time. They take it like right before they're trying to go to bed to fall asleep. And you actually need to take it, 4 to 5 hours before you go to bed, because it helps supplement that natural increase in melatonin that's going to happen in the early evening time. So that's one mistake that I see a lot of people make, is just taking it at the wrong time. But I mean, definitely, if you're having difficulty sleeping, I think talking with your physician about what would be the best treatment for you. Is it melatonin? Is it seeing a provider who does cognitive behavioral therapy for insomnia? Because that is a non-pharmacological treatment, is actually the recommended treatment for insomnia. Perhaps you need to do a sleep study to see really what is going on while you're sleeping. Sleep apnea is a sleep disorder that's very underdiagnosed in adults.
Yes.
And so there's a lot of people that have sleep apnea and they don't know it. And so, there's ways to kind of screen people for sleep apnea that we do in our research.
That can be very dangerous.
It's very dangerous, yeah, because it really puts a stress on your sympathetic nervous system and puts you at a higher risk for having a stroke and cardiovascular disease. So I think, I definitely caution people from just like going out and buying melatonin and just taking that because they've heard about it, or, they have other people doing it, but really talking to the physician to figure out like really what is going on with your sleep, and then deciding with your physician what's the best course of action to treat your specific sleep need type thing.
Now, do you see the field that you're in as a physical therapist focused on sleep behaviors? Is that a field that you feel will be growing so that people don't just go to a physician, but they may go to a physical therapist and learn more about how they can control and optimize their quality of sleep?
Right. So I certainly have a big passion for reaching out to my profession, my physical therapy colleagues in my profession, in order to better educate people, physical therapists, about how we can actually help our patients sleep better. That's within our scope of practice. We're not physicians, so we're not doing sleep studies, and we're not diagnosing sleep disorders by any means. I've undergone training to do cognitive behavioral therapy for insomnia, so I do that as part of research projects, but not as part of a physical therapy practice. And I'm not suggesting that PTs or OTs or other healthcare providers necessarily should become experts in doing CBTI, but I certainly think that we can be educating our patients about ways to implement sleep hygiene that we kind of talked about. I think those are conversations that we can have with people. And also really, assessing our clients' sleep. Just doing simple things as how much sleep are you getting? How would you rate your sleep quality? And then deciding, can we assess for risk of having insomnia or sleep apnea, and then referring them to a physician for further testing. So I would like to see the PT community, having a better ability to kind of do some basic assessment of sleep disorder risk, and then also educating people about proper sleep hygiene, because I see that as a really good opportunity to identify those people who do have sleep disorders and maybe don't know it, get them treated for those sleep disorders. But then I also see it as a really awesome opportunity to perhaps prevent sleep disorders from happening, because we as PTs, we often get to see people right after they've had an injury, or they've had surgery, or they've had, a stroke or a diagnosis of MS. We're seeing these people right after they've had this event. Right. And for a lot of people after that event, they have disturbed sleep. I mean, right? It makes sense. If you've had surgery, it's going to potentially interfere with your ability to sleep. So what if we could educate people about, okay, your sleep's disturbed right now, but as your injury heals, try to get back on a good sleep hygiene schedule as quickly as you can. Because what I think a lot of times happens is, people have had an injury or a surgery, and they develop poor sleep hygiene techniques, which then they maybe heal from that surgery or injury, but then those poor sleep hygiene behaviors continue, which then could put them at a higher risk for developing insomnia.
Yes.
So I see PTs and OTs and other healthcare providers as having, kind of an awesome opportunity to potentially prevent the onset of, insomnia and other sleep issues.
Yes. Katie, is there any other things that you would want to get out to a listener that feels that, I am not getting enough sleep and it's not the quality that I want? Mm-hmm. What would you recommend to them?
I'd recommend talk with your physician. I mean, I think that's really the very good first step is, talk to your physician about what's going on with your sleep, and talk about then what's the best course of action for you. It may be doing a sleep study, it may be getting on medications, it may be going to a provider who does cognitive behavioral therapy for insomnia. But I mean, really identifying what is your sleep issue. And I think too, because often what I see in the individuals that I work with, I think sleep concerns are sometimes put on the back burner. Right. When you go to talk to your physician about, whatever other health concern you have. Or people sometimes think, oh, well, I've broken my leg. Why would I talk about my sleep issue? Or, oh, I'm having issues with, my heartburn. Of course, that's going to interfere with my sleep. But I think, advocating to have your sleep concerns addressed is also what I would encourage people to do as well.
Yes. Well, thank you very much. And for those commandos out there, just as a personal testimony, one of the things that has been very important for myself here, I'd say just in the last 6 months, is focusing more on sleep. And it's not an accident that put me in contact with Kansas University Medical Center, who has been doing a lot of this research. But, myself in my own particular situation, making a list of those priorities which are of greatest importance in your life, from your health, your family, your profession, and then some of those things that are not as high a priority, and figuring out how to lighten those. As Katie had just mentioned, your health. Studies had been shown that patients with multiple sclerosis, aerobic exercise did help improve sleep, and so those things, I take away and apply in my own lifestyle, focusing more on the aerobic exercise, our nutrition. Those patients that have undergone a stroke, it's oftentimes not in today's day and age from blunt impact. It's a lot of times it's cholesterol buildup in the plaques in our body, and watching what we are eating and quantity and quality, and then being cognizant of making sure that we can improve. If you're feeling tired and sleepy and you can't retain information, you're not performing your best at work, but also you could be doing some long-term professional and personal damage. So this is a very important topic, and we really thank you so much for providing this information to the viewers, and look forward to talking to some other folks upcoming from the University of Kansas Medical Center and some of the soon-to-come podcasts.
Great. Well, thank you for having me. I really enjoyed it.
Yes, thank you. All right.
To all my fellow grunts out there who in your youth felt it was your duty to protect us, I salute you. And thanks to the listeners of the Go Commando Show who labor on the farm, who are sweating on the construction site, putting forth your very best at the office, you are making a difference. Support the Go Commando Show in our pursuit of bringing you the highest quality professionals. Infiltrate the website at gocommandoshow.com, where you can view all of the podcasts and arm your team with incredible deals on health supplements, commando clothing, and equipment. Every time that you get a good deal, it supports the show. What deals? When you purchase anything from the website, Amazon, healthcare supplements, you're covering our six. And to the ladies on the team, when you outfit yourself in the super sexy threads from Naked Zebra, and yes, I'm talking about in a fuego, you are firing the sniper shot for our commandos. How else can you support? It's simple. You smash the follow and subscribe buttons on our social media. That is how you support us bringing great guests to talk about serious subjects, not the mainstream media's fake news. So thank you, and until our next show, stay in the attack and go Commando.